Is it normal to have bumps on your penis that aren't an STI? Absolutely. Can a human heart actually be unraveled like a garden hose? Are you completely helpless against parasites in your food? And do women secretly have Adam's apples too? Today, we're answering more strange, uncomfortable, and slightly chaotic medical questions people are too embarrassed to ask their doctor. Either way, we're breaking them all down, so let's dive right in. Is it true that low iron levels equate to more herpes and increased risk of cancer? Not exactly. Having low iron in your system decreases your immune system, which then makes you more susceptible to potentially getting herpes. And what is herpes? Herpes it's a virus typically spread through saliva, and people get the lesions on their lips, usually, or around their mouth, that stays in our system. So a lot of people actually have it without actually showing the virus with the blister. And then when it comes to cancers, low iron levels don't necessarily make you more susceptible to cancer, but low iron levels could be an indication that you might have cancer going on in your system because it's utilizing your body's resources. If a doctor tells you you have iron deficiency and you don't have a good reason for it, you definitely need a workup. Why is it called an Adam's apple? Do women have Adam's apples? Yes, women have Adam's apples. The name comes from the old Bible legend of Adam eating from the forbidden tree and a piece of the apple getting stuck in his throat. It's actually a piece of cartilage that we all have. It's your thyroid cartilage that basically protrudes here and covers our voice box, basically. When boys go through puberty, the testosterone has a little bit stronger effect on that cartilage, making it a little bit larger, thus the deeper voice of men. Can someone actually be scared to death? Believe it or not, yes. So when somebody is scared or stressed to such a level, you release your catecholamines or your stress hormones. Your heart is pounding, your blood pressure is elevated, and you can increase the stress on your heart. And some people are a little bit more susceptible to it if you already have your coronary blood vessels that are narrowing. And so we can see sometimes it pop up in somebody who's not actually having a heart attack, and it's due to the fact that they've stressed their body so much and then they don't have good flow to the heart itself, thus causing some damage. Is there such a thing as being immune to anesthesia? No one is actually immune to anesthesia, just some people require different doses. And that's just because genetically we're made different body habitus, basically obesity or really skinny, or if you're taking medications, a lot of different factors go into our responses to anesthesia. But they have shown a true redhead will potentially require a little bit more anesthesia, and this requirement of a little bit more anesthesia has been linked to a variant of the MC1R gene. Do human eggs in a woman have shells like chickens? No, but really interesting, fun question. But no, human eggs are microscopic, literally 0.1 millimeters, making them actually the largest cell in the body. But instead of a hard shell, the human egg is surrounded by the zona pellucida. The zona pellucida is a protective coating like a hard shell would be, which is like a jelly-like structure. It allows the sperm to get in, but it also prevents multiple sperm from getting in and having multiple fertilizations. It basically just lets one in there. How cool is that? And that the body knows. Why do doctors check your ankles when your complaint has nothing to do with your legs? This is a great question. There are a lot of organ systems that we can check or need to check by looking at your lower extremities. So we're not just looking at your ankles, we're looking at the lower extremity. We're seeing if there's edema, and these are indications of heart failure, liver failure, previous heart attacks. So when we look down at the lower extremities, we're looking because multiple organs have to do with fluid retention. What actually causes diarrhea with a parasite? I've heard of the new parasite going around, Cyclospora, but what actually causes the diarrhea? Well, first off, parasites like Cyclospora basically mess with the gut lining and they damage the cells of the gut, thus leading to not as good absorption of water, inflammation, irritation. So the normal cells of our body relating to the gut lining will absorb the water back into our body. What ends up happening is because of the damage, that water is now continually staying within the intestines, and thus tons of large amounts of watery diarrhea. Is it normal to have bumps on your penis that aren't an STI? Absolutely. Not everything is a sexually transmitted infection. You can have something called pearly penile papules, which are totally normal. You can also have fortis spots, which are glands. You can have an ingrown hair. There are things that may look abnormal or of concern, but are not sexually transmitted. If you do have a concern, talk to your doctor about it. They can do a quick exam and tell you what it is. Schizophrenia runs in my family. Is there anything I can do not to get it? Schizophrenia is one of the most complex conditions in medicine because there isn't actually like one cause. Scientists believe that it's a combination of genetics, brain development, as well as environmental factors. So if you have a sibling or parent that is schizophrenic, you do have a higher chance of potentially getting or developing schizophrenia, but it doesn't mean everybody does. Researchers have found that people who are born blind actually have a much lower risk of getting schizophrenia. They don't know exactly why, but it has to do with how the brain develops because of this missing sense. I heard a myth that higher estrogen is linked to more skin cancer. Can you confirm or deny? So the short answer is having naturally higher estrogen levels has not been conclusively shown to cause skin cancer. However, newer research suggests that estrogen therapy may be associated with a slight increased risk of basal cell carcinoma, squamous cell carcinoma, and melanoma. Researchers aren't sure whether estrogen itself is responsible or whether other factors are contributing. So more studies are needed. Still, the biggest risk factors for developing skin cancer are exposure to UV light, history of severe sunburn, as well as tanning bed use. Scientists have studied whether hormones do play a role in melanoma or not, and it's a mixed bag. Can I really not smell in my sleep? Actually, mostly yes. The reason is that when you fall asleep, your brain dramatically shuts off or shuts down the response to smells. Your nose still detects the molecules, but your brain decides, it's not worth it to try to wake you up for these smells. When there's something to be concerned about, our brains will wake us up. Smoke, natural gas, irritants, they will set off alarm bells to wake our body up. I know we have bugs that live on our eyelashes pretty permanently. Do they live anywhere else on the body, and should I get rid of them? Yes, believe it or not, most adults have microscopic mites living on their skin right now. They're called Demodex mites. They're about the size of a grain of sand. They can be on the eyelashes, the eyebrows themselves, the forehead, nose, cheeks. They typically will eat up like dead skin cells and be protective to us. Sometimes if they overgrow or they develop more rapidly and there's lots of them, then it becomes an issue, and sometimes you can have inflammation of the eyelids. Then you might actually do something at that time. But in general, they're part of our own, say, ecosystem. Most people don't even notice them. Can your belly button actually grow a stone? My friend said he did, but I didn't believe him.
Hold it. This is getting confusing.
Surprisingly, yes, and I will explain it. It's called an omphalolith. It literally means belly button stone. But it's not like it's a rock or that you have different types of rock species in our body. What happens is you get lint, dead cells, bacteria that all sit in the belly button, and if not cleaned often, can compress and compress and compress down over a period of time, and they can form a hard material that looks like a black rock. Is there a link between solar storms and heart attacks? I've noticed more people in the hospital when that happens. Yes, this is actually an area that scientists are looking into and have been studying for years, because a solar storm typically changes slightly the Earth's magnetic field. So then some researchers are wondering if these tiny changes could influence blood pressure, heart rhythms, or your body's autonomic nervous system. And they have had some studies, very few studies, that show maybe a slight increase in stroke and heart attacks, but the evidence is quite inconsistent. What is a medical question that you have always been curious about? Let me know in the comments below. If you enjoyed this and you want to see more, there's plenty of Discord medical question videos that we have made. Here's the playlist right here, binge watch everything. And as always, do me a favor, subscribe, turn on your bell notifications, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.